Hi everyone, Anna here with the Coding Guild. Today we are going to explore AAPC's brand new credential, the CDEI, what stands for Certified Documentation Expert Inpatient. This credential is the counterpart of the CDEO, but also covers documentation improvement, but that one is for the outpatient side. This new credential deals with inpatient places of service only. So what do we know so far? The CDEI is currently in beta testing mode and can be attempted for free. Yes, that's correct, you can take this exam for free for now, but there is a caveat. All potential examinees must apply for this exam and must be accepted by AAPC to test, and as part of your application you have to send in your resume to prove at least 2 years experience in a medical role or as a scribe. Or that's at least what the website says. But based on discussions I had with AAPC representatives, it seems that previous inpatient coding experience or CDI experience in an inpatient setting will also be considered for potential examinees. What's funny is that one of the representatives emphasized not to get too enthusiastic about this, because just the fact that somebody would be allowed to sit for this test doesn't mean that they would pass this test. And the reason behind this is that the CDEI is much more involved medically. If we look at the website, it is there plain and simple that the examinee will be tested on medical terminology, anatomy, pathophysiology, and clinical conditions. And this is understandable because CDI professionals have to notice things that are missing from the documentation based on signs, symptoms, and course of disease. It is not enough to just notice that something is wrong that's already present. One must be able to fill in the gaps in medical documentation, and that is only possible if somebody possesses medical knowledge. So it's a little bit broader than just simple coding and billing for inpatient services. Speaking of billing and coding, this exam also addresses revenue cycle related issues and reimbursement topics. The website doesn't go into detail as to whether they are only asking about acute inpatient reimbursement topics or everything else, long-term care rehabilitation and so on, but I would say we probably have to know everything, because in the introduction it says that the examinee must have a thorough knowledge of healthcare reimbursement concepts. It's in plural, so my vote is that you have to know everything. There are also compliance and regulatory questions as related to inpatient care. And finally, of course, the examinee must be familiar with inpatient quality measures and CDI as a concept, as a whole. How to review documentation, what to look out for, how to give feedback to the provider, and so on. Currently, the biggest challenge to potential examinees is that there is no published course for this credential quite yet from AAPC, but it is in the making, so please keep an eye out for it if you are interested. Until then, there are 2 more credentialing agencies that worth checking out. The first one, of course, is AHIMA. Their credential is the CDIP for Certified Documentation Improvement Practitioners. It is said to be a more advanced level of clinical documentation improvement, and they do have some courses, books, and other material you can review. Not sure how that will translate to AAPC's exam, but it's better than absolutely nothing. Besides AHIMA, have a look at ACDIS. They are the Association of Clinical Documentation Integrity Specialists, and their credential is the CCDS, or Certified Clinical Documentation Specialist credential. This organization also has courses, books, and other material that might help you get ready for the CDEI. Again, not sure how well it will overlap, but if the material is good enough to pass these higher level CDI exams, it should be good enough to pass the CDEI. And by the way, I have no idea how hard the CDEI is. It is only from hearsay, what I heard and saw on forums and on Facebook, that the AHIMA and the ACDIS credentials are higher level. I don't know, maybe the CDEI is terribly hard. You let me know. As for the technicals, this exam is taken online, so there is no need to go anywhere, and all examinees will have one free attempt. There is no word of paid attempts at this point, so if you are selected, try to make it in one go for now. Unfortunately, neither the length of the exam nor the question types are public knowledge at this point, so we don't know if it's multiple choice, fill in the blank, or something totally new. But the representative I talked to assured me that all examinees who are accepted will be given more detail before they show up, so don't worry. If you are interested, please go to the CDEI official page, link in the description below. Put in all your details in the questionnaire, upload your resume, agree to all those legal points, and off your application goes. A very interesting thing I would like to draw your attention to is a sentence within those checkboxes you have to accept, and it reads like so. I understand that I am not permitted to use any resources during the beta exam. I found it hard to believe, so I asked AAPC what they mean by this and how exactly the examinee is expected to code PCS and diagnosis codes without any coding books. And I was told that coding is not really part of this exam. This is clinical documentation improvement. So the idea is more that the examinee must be very familiar with the guidelines and has to recognize how many different specificities of a code there are. So for example, atrial fibrillation, and they have to recognize that something, the specificity is missing from the documentation and so on. Choosing codes or procedural codes will not be necessary. For PCS coding, one might have to recognize which root operation would be correct here, or which root operation would elevate the MSDRG, but that's as far as it goes. So don't worry about this line. I freaked out a little bit when I saw this. I'm not used to taking exams without anything around me. And that's all I have about this credential right now, but stay tuned, like and subscribe to make sure that you don't miss any new updates that AAPC comes out with. Thank you for being here with me today. I will see you soon in our next video.